बहुत सही बना, कितना
तो यार ऐसा कुछ रूम है और ये मैंने बेड यहाँ पे लगा दिया है, ठीक है। और ये मेरे बाजू वाले का बेड, ये हमारा फ्रिज और ये है हम। तो जिसको नहीं पता उसको मैं बता दूं कि मैं थर्ड हॉस्टल में शिफ्ट हो गया हूँ, ठीक है। बहुत दिन हो गए, व्लॉग नहीं डाला था उसका, मैं डाल दूंगा। बहुत दिन से सोच रहा हूँ मैं, बट डाल नहीं पा रहा हूँ, तो उसका थोड़ा वेट कर लो भाई, है ना, क्योंकि मुझे डालना है व्लॉग उसका। और बस यही है, जूते पहन रहे हैं अभी और फिर जाते हैं कॉलेज, क्योंकि आज इमरजेंसी मेडिसिन की क्लास तो है ही, और आज का टॉपिक हाइपरटेंसिव क्राइसिस है, इसलिए तो चलो दिखा देता हूँ मैं। वही क्लास है, पिछले बार नेवल्स का में हुई थी, अभी यहाँ हो रही है फिफ्थ कॉर्पस में। और आज से शायद स्टेशंस भी होंगे जो मैं बता रहा था, तो भी आज बुड्ढे अंकल आए हैं टैक्सी में, पता नहीं कब पहुंचाएंगे। क्या लगता है कब पहुंचेंगे? देखो ये होता है गार्दिरो भाई, इधर रखते हैं ठंड में जैकेट, यहाँ से बैग उठाओ, एप्रन पहनो और चल दो फिफ्थ कॉर्पस।
So initially, проба отрицательная. Так, проба отрицательная. Помощник, возьмите помощник реаниматолога, начинайте компрессию грудной клетки.
के अंदर डिसीज
Продолжайте компрессию. Готовлю шприц с кислородным раствором. 20 миллилитров. Эпинефрин 0,7%.
क्यों?
Who is absent?
Urvashi,
Why?
she is in polyclinic.
What was it? Feels his Okay. Tachycardia, maybe. Okay, what else? Can it be clinically silent?
Yes ma'am.
Silent hypertension.
Silent
One more
hypertension.
type possible. Okay. What typical signs? Very typical.
Palpitation.
Palpitations.
Palpitations.
What about head?
Pump.
Headache. Typical.
Clumping headache.
What else? What gastrointestinal manifestations typical?
Bloating.
Nausea
And vomiting.
Yes, this is clinical picture. Now let's talk about that vision. If eyes affected vessels, it is possible. Now treatment of urgency, hypertensive urgency treatment. Question for Surya.
इसमें तो नॉर्मली
Treatment
कम
of
कर सकते हैं ओरल
urgency.
Hydroxyl, ma'am, we will give ma'am ARVs, ma'am. Angiotensin receptor blocker, captopril.
No, captopril, it is not ARVs, first
ये
of all.
सार्टेन है लो सार्टेन
Elmisartan, and sodium nitrotenside.
Sodium nitroprusside and
Calcium channel blocker will be.
What difference in treatment of hypertensive crisis and arterial hypertension? Oh, everything is in rush. After treatment, you call ambulance. It is your dialogue with the teacher, and in which you call ambulance. You say information about patients, that he is male, he is mean age about 40, you suspect following diagnosis, and why do you suspect this, and how did you treat him, what did you prescribe him. After that, you also says address. You can choose any address as you want. And if you forgot something to tell, teacher can ask you, for example, help us with some person who is sick. No one came to you because you must demonstrate your skills alone. Then you use gloves. In stations we always works in gloves. In Russian, одеваем перчатки. And then you will make sure that all medications are present. Укладка обеспечена. That means medications present. Phonendoscope, you must have your personal phonendoscope for station. Укладка обеспечена. The medications for emergency are present.
All medicines
Обеспечена. Present присутствует. Можно, you can say, укладка присутствует. Examples of speech, Russian speech is given. You can just learn by heart speech which I gave you in there. Then you start A, B, C, D, E. I cannot be so loud as you. I am not Indian, and I belong to you. Okay? So A point is airways. You check airways. In Russian оцениваю проходимость дыхательных путей. Teacher give you response. Does it clear or does foreign body or something present? He give you response. Next point is B, breathing. And here you start with pulse oximetry. You use this equipment, imitation, put it on patient finger, and watch result on the screen. Saturation is this 88.
Less than 90.
It is low, it is very decreased saturation. That means patients required mask. Where is the mask? And you put mask, connect it with oxygen source, put on patient face, and comment that airflow is mid intensity. Использую маску, кислородотерапия, поток кислорода средний. You have done. Next point in B, point in breathing, you can do auscultation of heart. You have your personal steps, phonendoscope, and you listen to the patient's lung. First intercostal space, second, and you can listen in lateral size. Patient really reflect sounds, and you will really listen. We will train today, and you give comment about what breathing type in patient. Then you do percussion. It is propedeutics. First, second intercostal space, you did it, it is enough. Teacher says result. Then you can check respiratory movements of patient's chest, expansion chest for 10 seconds and give result. Calculate that and give result. Then you check trachea, condition of trachea and neck vein with light source, and teacher says your result. Because vein may be swollen, may be decreased, non-visible, may be normal, and so on. This is B, breathing point, it is finished. Next point, C, circulation, cardiovascular system. You start with pulse in radial artery and carotid artery, then in radial artery bilateral, and then in one radial artery in 10 seconds you check, calculate pulse. Mannequin reflect pulse, you can check it. You can find connection to light. If you have a light in your telephone, you can try and pupil reaction must be present.
कहाँ है?
कंस्ट्रिक्ट हो रही है ये देखो.
Does it?
यस मैम. बहुत मजा आ
Does
रहा
it or not?
है. यस मैम इट्स डूइंग.
I see, as far as I see here, it's
तगड़ा बनाया
clearly
बहुत.
seen.
बहुत सही बना.
Pupil
कितने का?
reaction is present.
How much? Ma'am, how expensive is this?
How much price,
How
ma'am?
good?
Price of this cadaver?
Oh,
Very expensive.
Gram perorально.
75 liquid.
One more stamp. We have heparin, 5000 units, 5000 единиц, инъекция внутрикожная, область живота, abdominal area. Морфин, морфин-гидрохлорид, морфиногидрохлорид, 10 milligram
IV.
with dilution of sodium chloride. You take it intravenously, you use it intravenously, внутривенно, капельно. Some medications may be внутривенно, quickly, быстро, болюсно, and so on. If you have infusion therapy, инфузия, sodium chloride, раствор натрия хлорида, 500 мл, внутривенно, медленно. You try to connect, but at this moment it is broken, slightly broken. You did it. I don't see where is nebulizer. Tomorrow
अच्छा,
I will show
nebulizer.
you with nebulizer. Next time.
Laser तो
After complete treatment, as I said you before, you call ambulance, then you do re-examination. It is heart rate and pulse rate. It is BP level, saturation, and body temperature in Celsius system. Next parameter, what you that you ask teacher and teacher give you response. They are parameters which are when you do percussion, teacher says your result. It is percussion. Then trachea, neck veins, teacher give you result. One more teacher says you. It is palpation of abdomen. It is spine when you check spine of patient
Palpation of
on the legs.
Varicose
Edema
veins on the legs. Edema on the legs.
Rectal examination if required. It is also teacher says you.
Light
Light reaction to the light
ये
of
पता
eyes.
मैम बताएंगी या हमको करना है?
Iris reflex.
Muscle tone.
मसल टोन.
Muscle tone. Glucometry. Teacher says you also glucometry. One more task. And probably that is all. Finally, parameters which you comment, which you find on mannequin, recognize it and give comment about result.
How will we diagnose?
Checked. All kind of auscultation, heart auscultation, lung auscultation, then pulse, every kind of pulse, on hand, on carotid artery, on femoral artery, all pulsation is given by mannequin. And what else? And probably that's all. And I have remember one more science teacher says white spot sign, capillary
Capillary
filling.
fill.
Teacher says capillary filling result and skin color of patient. Teacher also says skin color of patient. These are parameters.
ओके मैम. ये हमको चेक करना है ना मैम. These are the parameter. कैपिलरी नहीं.